Welcome back to Uncommon Experts. We're here today with Diana from Medical Park Family Care. So Diana, I noticed that you have 13 doctors at Medical Park Family Care. That's an awful lot. Can you tell me some of the unique areas of focus in your practice?
Sure. As we've touched on before, it is everything from men's health, women's health, children's health, overall health and well-being. But we also have an occupational health division that is a little more specialized.
And what kind of occupational health services do you offer?
Sure. Good question. A lot of those are a little more employer related.
So it's like drug testing?
Yes. Yes. We do a lot of the different drug testings that are there. People can either come in and do that, or with some of them we can actually go off site.
Wow, you have a doctor who does house calls, corporate house calls.
We actually have somebody that works in our department, not one of the physicians, but who actually will go out and do that.
And what about things like OSHA or a HAZWOP? Do you do those kind of things as well?
We do. Those are some of the services that we do. We also do a lot with FAA.
Really? You do aviation services?
We do. We have 5 aviation medical examiners on staff.
That's an awful lot.
Yes.
So you must see a lot of pilots.
We do. Lots of pilots.
Do you just do FAA exams, or are there other types you do as well?
Well, there's a lot of other exams, but touching a little bit even more on those FAA exams, we do Class 1, Class 2, Class 3, and we also do a lot of students, which is very nice because on kind of an added addition to working with the students is that we offer them a discount.
You give students a discount for their exams?
We do on their initial flight exam, so yeah.
So do you do things for Trans-Canada?
We do. We have several of the Asian airlines that we work with as well. People will come in and are traveling, and we'll do a lot of things for the pilots that are not staying in the continental United States as well. So
it's nice to be the Alaskan hub there.
Yes, absolutely.
Do you do pre-placement exams?
We do in Alaska, because we have such a unique work environment in many of the cases. A lot of employers are fairly specific about the types of physicals and that we need to do and the capabilities of their employees, so yes.
What about things like crew member services? Are those offered?
We do everything for, again, and that a lot of that ties back into the aviation field. We have a lot of individuals that are hurt on the job. Something happens while they're flying, or they've flown somewhere and something has happened. They're able to come in and be seen right away. And really those vary. I mean, we've got some pilots that are coming in for even more serious concerns.
Can you give me some examples of that?
Sure. Heart issues.
Okay.
They can actually come in and have an EKG done. We have the treadmill there that we're actually able to do stress tests for. And we even do nerve conduction study.
I don't know what that is.
So basically they have the ability, we're getting tingling in our fingers, we're getting weird feelings in our toes. Folks have the ability to come in and have a study done to figure out how their nerves are functioning, what it is that isn't functioning, and take it from there. So.
What about the more mundane things that you find, like asbestos exams?
Yep. A lot of that with the asbestos is folks are coming in for their mask fitting tests.
What's a mask fitting test?
Well, typically when somebody is working with hazardous materials, you want to have a situation where their mask is fitting appropriately, so it's keeping all of the toxins out.
Okay.
And so when they come in for that fit test, we're making sure that the masks are fitting appropriately and that there's no wear and tear and damage.
I know that some people need exams to get a CDL. Do you guys do that sort of thing?
Absolutely. Yeah, we do everything from dive physicals to CDL physicals.
What is a dive physical?
For individuals that do underwater diving of any sort, whether we're doing the welding, whether it's a personal. I'm always amazed at the number of people that we have that dive in Alaska.
Do you guys do things like blood draws and immunizations as well?
We do, and as an addition to that, we will, free of charge, go out to employers and offer some of those services at their place of employment.
That's really exciting. So you don't have to leave the workplace to get your medical taken care of.
Right, right.
How does that tie into being a family doctor?
Well, we focus a lot on overall health and wellness, and we know that that ties in directly with our jobs. So a lot of employers are begging us to come in and can you please do a flu shot clinic here where I have a captive audience, where their employees are all there. Can you please come in and do blood pressure clinics? Can you please come in and get my folks familiar with a medical clinic as an option rather than running to the ER? Just overall education. Employers are realizing, especially with healthcare costs, what they are, and insurance, how important it is to make sure that their employees are healthy, and we work alongside them to make that happen and don't charge extra for that.
I'm sure preventative medicine is a lot cheaper than increased insurance premiums.
Absolutely. Crisis mode is kind of how a lot of us operate when it comes to our health care, and that's one of the things that we're really working against. And again, with the employers, they don't want their employees to wait until crisis mode.
Right.
So
I'm also wondering about the average Alaskan family. What are the family services that you offer?
sure. Well, with the family services, we offer individuals the ability to come in as a family. Again, always tying back into that family. You feel like you're part of a family. You come in and you immediately have that warm comfort of family. But you can also bring in your whole family. So mom, dad, kids all have special needs that they need tended to. That could be anywhere from coming in for immunizations or a back-to-school physical. Mom is maybe due for her annual. Dad has some concerns, about prostate cancer. They can all come in and be seen at the same time on the same day.
I know for people who don't live in Anchorage, it's a big deal to be able to have that kind of care. But how do you maintain that kind of care when you live in the bush?
Sure. That ties back into our interactive website. By having an interactive website, it gives individuals the ability, if they know when they're going to be in town, because typically folks that don't live in Anchorage do know when they're going to be back in Anchorage, and they can go online and plan accordingly and schedule their appointment during that time. Again, with the prescription refill request, that's another thing that folks can go on and request one and have their medications sent to the pharmacy wherever they are. And we're dealing with that with a lot of the folks in the military right now.
Now that's got to be a little hard because if you're in the military or in the bush and you have diabetes, getting back to your clinic every 3 months for a checkup has got to be a bit of a strain.
Yeah, absolutely. And with cases like that, we have a triage nurse, and she is the one that kind of acts as a liaison between the doctors and the nurses, and she's funneling those types of calls. We do have a lot of folks that, like I said, are in the military and are over in Afghanistan, and they are actually calling in and speaking to our triage nurse and letting her know that there's some extenuating circumstances, and then our doctors and nurses are able to act accordingly.
Great. Next on Uncommon Experts, we'll be meeting with Dr. Michael Reeves of the Medical Park Family Care.